Hello everyone, welcome to Similia Cosmos. Let us try to understand the concepts related to the word accessory in Organon of Medicine. So the terms which are related to the word accessory in Organon of Medicine are the accessory circumstances, the accessory miasm, lesser accessory symptoms of the patient, accessory symptoms of the medicine. So beginning with accessory circumstances, which is mentioned by Hahnemann in aphorism 7 while explaining the totality of symptoms. So while constructing the totality of symptoms along with signs and symptoms, we have to give importance to certain modifying factors in a chronic case, especially such as physical constitution, mode of living and habits, social and domestic relations, and moral and intellectual character, age, sexual function, etc. So these are the modifying factors which are termed as accessory circumstances by Hahnemann in aphorism 7. So Hahnemann mentions about accessory miasm in aphorism 46 of 6th edition of Organon of Medicine. So here Hahnemann speaks about cowpox inoculation. So when cowpox inoculation happens, along with the protective nature of cowpox inoculation, which is nothing but cowpox vaccination, it is also capable of producing, after giving the vaccination, it produces a certain general cutaneous eruption, that means skin symptoms. So these skin symptoms disappear after a few days. So this skin symptom which is produced by the cowpox inoculation is called as accessory miasm. It is observed that in many cases of especially children, many cutaneous eruption, which is skin eruptions, were permanently removed after taking cowpox inoculation. And why? Because this cowpox inoculation was able to cause this general cutaneous eruption, which is the accessory miasm. So the question related to accessory miasm will be with respect to which disease. So you should understand that, or with respect to which inoculation, you should understand that it is cowpox. Next, coming to the concept of lesser accessory symptoms of patient, which is a favorite question of any examiner. So this is mentioned in aphorism 95 in 6th edition of Organon of Medicine by Master Hahnemann while discussing case taking, especially in a chronic case. So what happens when we take a chronic case? There is a tendency of patients not giving you certain symptoms because they might think they are suffering from so many years, so they might think it is a part and parcel of their normal life, or certain symptoms usually they forget. So these minute peculiarities, Hahnemann tells, which the patient tends to forget or not mention during the case taking, are a suitable guide for selection of remedy. So these are mostly characteristic symptoms which the patient ignores or doesn't remember or forgets to mention. So these symptoms we have to elicit in a patient, and these symptoms which the patient forgets or doesn't mention during the case taking are lesser accessory symptoms of the patient. Next is accessory symptoms of medicine. Accessory symptoms of medicine is mentioned by Hahnemann in aphorism 163 and aphorism 167, and this is mentioned while explaining what happens when we manage a case with a partially indicated remedy. So there are certain scenarios where we will have to give a partially indicated remedy. It could be because the symptoms are less in the patient, for which we cannot give a similar, or we cannot find an exact proved remedy for the symptomatology of the patient. So here we will have to manage the case with a partially similar remedy. So when a partially similar remedy or a partially indicated remedy, this is an imperfect remedy, right? So it is given to the patient. The patient now suffers from original disease, and this remedy is capable of producing its symptoms in the patient. So now patient suffers from original disease and also along with that the symptoms of the medicine. So these symptoms of the medicine which are produced in a patient who is being given with a partially similar remedy are the accessory symptoms of the medicine, because it is produced by the medicine. So this is mentioned in aphorism 163. And in 167, Hahnemann tells that once you get accessory symptoms of medicine and then the original disease picture is also present in the patient, you have to construct a new totality. So this new totality will be original symptoms of the patient plus the accessory symptoms of the medicine, and then an indicated remedy should be given. This is how we manage a case when a indicated medicine is a partially similar medicine. So this is mentioned in 163 and 167. Now a quick revision: accessory circumstances is mentioned in aphorism 7, accessory miasm is mentioned in aphorism 46, accessory symptoms of the patient, which is lesser accessory symptoms of the patient, is mentioned in aphorism 95, and accessory symptoms of the medicine is mentioned in aphorism 163 and 167. If you understood the concepts, like, comment and share our video to the maximum number of people, and also follow our channel Similia Cosmos.